army, join the army.
Okay people, welcome back to the channel. Just have to do audio only for this video. I'll apologize. Welcome back to the second installment of the COVID coronavirus. And in this video, we're going to jump into the vaccinations. I do realize that it's 5 years later, and some of the information that we are just now privy to came out only 7 days ago. Today is Thursday, June 5th, 2025. So a week ago from today, the video that you will see in the last segment of this video, yeah, it's 7 days old. So we're still getting massive amounts of information. We're going to see what bullshit that Anthony Fauci has spouted and how even 2 to 3 years later, he still was not telling the truth about COVID, the origins, or the vaccines. This man was approved by President Biden to go on TV and tell the entire nation, if you take these vaccines, you won't get COVID. I know in my family at the time, my wife and daughter didn't get the COVID vaccine, but I had to because it was mandated. In order for me to get back in the truck in my company, it was mandated we got the vaccination. Just like with any business that had over 100 employees. This is 2 and 3 years of lies after lies after lies. Even when Fauci is called in lies, he is still going to lie.
Data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real-world data.
The situation is so clear, the data affirm, if you get vaccinated, you are protected, even with the Delta variant. We know that as a fact.
You're okay. You're not going to get COVID if you have these vaccinations.
Now, as we see many vaccinated people continuing to get COVID, we know for a fact that this was not true. Vaccinated Americans can still get coronavirus. As Fauci said in January, Omicron, with its extraordinary unprecedented degree of efficiency of transmissibility, will ultimately find just about everyone. American women expressed concerns early on about how vaccines would affect their fertility, complaining on social media that their menstrual cycle had changed since getting the vaccine. Media and health officials repeatedly assured the public that there was no evidence to suggest COVID vaccines negatively affect fertility. But women have criticized media dismissals of their concerns, saying they deserve real answers from medical professionals about how the vaccine affects their fertility. Fauci has repeatedly denied that agencies under his direction engaged in gain-of-function research in the Wuhan Institute of Virology. Media called pushback on this claim from people like Senator Rand Paul misinformation, that the Wuhan Institute of Virology had failed to immediately notify that it had engaged in what sure looks a lot like gain-of-function research, creating a lab-generated chimeric coronavirus between June 2018 and May 2019 that tested more deadly on mice with humanized cells than the natural virus it was made from.
This paper that you are referring to was judged by qualified staff up and down the chain as not being gain of function.
So
let me finish.
You take an animal virus and you increase its transmissibility to humans,
right.
You're saying that's not gain of function?
Yeah.
Biden and Fauci have repeatedly blamed the unvaccinated for propagating outbreaks of the coronavirus Delta and Omicron variants. As recently as January 13th, Biden said that this is a pandemic of the unvaccinated, but the president and health officials who continue to cite breakthrough cases are either forgetting or ignoring the many, many vaccinated Americans who have contracted COVID as of late.
This is a pandemic of the unvaccinated. And I mean by this, right now, both vaccinated and unvaccinated people are testing positive.
Wait, what? I don't get it. Isn't that the same as saying, take this pill and you won't be sick? Or, don't take this pill and you won't be sick? Makes no sense. That man never made any sense.
We now know that we have been lied to by the very people that claim to be protecting us, and we have been lied to repeatedly.
I don't expect you today to admit that you approved of NIH funding for gain-of-function research in Wuhan, but your repeated denials have worn thin, and a majority of Americans, frankly, don't believe you. Even the NIH now admits that EcoHealth Alliance did perform experiments in Wuhan that created viruses not found in nature that actually did gain in lethality. The facts are clear. The NIH did fund gain-of-function research in Wuhan, despite your protestations. You can deny it all you want, but even the Chinese authors of the paper, in their paper, admit that viruses not found in nature were created, and yes, they gained in infectivity. Your persistent denials, though, are not simply a stain on your reputation, but are a clear and present danger to the country and to the world. As Professor Kevin Esvelt of MIT has written, gain-of-function research looks like a gamble that civilization can't afford to risk. And yet here we are again with you steadfast in your denials. Why does it matter? Because gain-of-function research with laboratory-created viruses not found in nature could cause a pandemic even worse the next time. We're suffering today from one that has a mortality of approximately 1%. They're experimenting with viruses that have mortalities of between 15 and 50%. Yes, our civilization could be at risk from one of these viruses. Experiments that combine unknown viruses with known pandemic-causing viruses are incredibly risky. Experiments that combine unknown viruses with coronaviruses that have as much as 50% mortality could endanger civilization as we know it. And here you sit, unwilling to accept any responsibility for the current pandemic and unwilling to take any steps to prevent gain-of-function research from possibly unleashing an even more deadly virus. You mislead the public by saying that the published viruses could not be COVID. Well, exactly no one is alleging that. No one is alleging that the published viruses by the Chinese are COVID. What we are saying is that this was risky type of research, gain-of-function research. It was risky to share this with the Chinese, and that COVID may have been created from a not yet revealed virus. We don't anticipate the Chinese are going to reveal the virus if it came from their lab. You know that, but you continue to mislead. You continue to support NIH money going to Wuhan. You continue to say you trust the Chinese scientist. You appear to have learned nothing from this pandemic. Will you today finally take some responsibility for funding gain-of-function research in Wuhan?
Senator, with all due respect, I disagree with so many of the things that you've said. First of all, gain of function is a very nebulous term. We have spent, not us, but outside bodies, a considerable amount of effort to give a more precise definition to the type of research that is of concern that might lead to a dangerous situation. You are aware of that. That is called P3CO.
We're aware that you deleted gain of function from the NIH website.
Well, I can get back to that in a moment if we have time. But let's get back to the operating framework and guide rails of which we operate under. And you have ignored them. The guidelines are very, very clear that you have to be dealing with a pathogen that clearly is shown and very likely to be highly transmissible in an uncontrollable way in humans and to have a high degree of morbidity and mortality, and that you do experiments to enhance that. Hence the word EPPP, enhanced pathogens of potential.
So when EcoHealth Alliance took the virus,
well,
SHC014, and combined it with WIV1 and caused a recombinant virus that doesn't exist in nature, and it made mice sicker, mice that had humanized cells, you're saying that that's not gain-of-function research?
According to the framework and guidelines.
So what you're doing is defining away gain-of-function. No. You're simply saying it doesn't exist because you changed the definition on the NIH website. This is terrible, and you're completely trying to escape the idea that we should do something about trying to prevent a pandemic from leaking from this because you changed the definition on the NIH website. This is terrible, and you're completely trying to escape the idea that we should do something about trying to prevent a pandemic from leaking from a lab. There's the preponderance of evidence now points towards this coming from the lab, and what you've done is change the definition on your website to try to cover your ass, basically. That's what you've done. You've changed the website to try to have a new definition that doesn't include the risky research that's going on. Until you admit that it's risky, we're not going to get anywhere. You have to admit that this research was risky. The NIH has now rebuked them. Your own agency has rebuked them. But the thing is you're still unwilling to admit that they gained in function when they say they became sicker. They gained in lethality. It's a new virus. That's not gain of function?
According to the definition that is currently operable, you know, Senator, let's make it clear for the people who are listening. The current definition was done over a 2 to 3 year period by outside bodies, including the NSABB, 2 conferences by the National Academy of Science, Engineering, and Medicine on December 2014, March 2016. We commissioned external risk-benefit assessment, and then on January of 2017, the Office of Science and Technology Policy of the White House issued the current policy.
And coincidentally,
I have not
the
changed
definition
any
appeared
definition.
on the same day the NIH said that, yes, there was a gain of function in Wuhan, the same day the definition appeared, the new definition, to try to define away what's going on in Wuhan. Until you accept it, until you accept responsibility, we're not going to get anywhere close to trying to prevent another lab leak of this dangerous sort of experiment. You won't admit that it's dangerous, and for that lack of judgment, I think it's time that you resign.
Thank you, Senator Paul, and I would like to give the time to Dr. Fauci.
Yeah, well, there were so many things that are egregious misrepresentation here, Madam Chair, that I don't think I'd be able to refute all of them, but just a couple of them for the listeners to hear for. You have said that I am unwilling to take any responsibility for the current pandemic. I have no responsibility for the current pandemic. The current pandemic, okay? Number two, you said the overwhelming amount of evidence indicates that's a lab leak. I believe most card-carrying viral phylogenists and molecular virologists would disagree with you that it is much more likely, even though we leave open all possibilities, it's much more likely that this was a natural occurrence. Third, you say
We've tested 80,000 animals, and no animals have been found with COVID.
Senator Paul, the time is for
And
Dr. Fauci to
third,
respond.
you made a statement just a moment ago that's completely incorrect, where you say we continue to support research at the Wuhan Institute of Virology.
You approved it in
which is
August of last
completely-
year.
No, your statement says, quote, I wrote it down as you were writing. You continue to support research at the Wuhan Institute of Virology.
You were in committee a month ago and
Which
said
is
you
Senator
still
Paul,
trust the
the-
Chinese scientists and you still support the research over there. You said it a month ago in
Senator
committee.
Paul, I have allowed Dr. Fauci to respond. You've had your time. I'm going to give him
He's
one
going to
more
be
minute.
dishonest. He ought to be challenged.
Senator Paul, we will allow Dr. Fauci to respond after you've given accusations like that. Dr. Fauci.
Well, I don't have any more to say except to say that, as usual, and I have a great deal of respect for this body of the Senate, and it makes me very uncomfortable to have to say something, but he is egregiously unusual, and I have a great deal of respect for this body of the Senate, and it makes me very uncomfortable to have to say something, but he is egregiously incorrect in what he says. Thank you.
History will figure that out on its own.
So we will turn to Senator Hassan. Thank you.
Yeah, I mean, look, I'm right there with Senator Rand Paul, okay? History will tell the tale, and it has. And he made no sense, no fucking sense whatsoever. He just sat there, and just like Rand Paul said, he changed the fucking definition and said this isn't gain of function. What? What are you talking about? Really? Really? There's a lot of things in this world that I don't understand. That being one of them. Just like I don't understand how you can call a man a woman. You can't. I really don't have the words to make a comment on Fauci right now. I really don't. It just baffles me how dumb these people think that we are. It baffles me. Moving on.
Occasionally, congressional oversight does something useful, in this case, very useful and very important. They forced Dr. Fauci, Dr. Anthony Fauci, to actually tell the truth about the National Institute of Health's funding of the Wuhan lab projects. Some other things about the pandemic. Fauci went into a closed-door meeting this week and provided 2 days of testimony, so under oath, 14 hours of questioning.
Over 100 times just on the first day, he couldn't recall.
6 feet of social distancing, was there science behind that?
He said there was not. What he came out and said was this just kind of somehow came out of nowhere, and we just went with it. I mean, this were some of the conversations
Mask
that we
mandates.
had. Same with the mask. Well, you know, we just said use whatever mask because we're having trouble getting masks. No, there's no science behind it. Why were we forcing these things? And I'll just tell you, as a doctor, you put on a mask. You just put cloth over your face. If you have COVID, you don't want to be wearing that mask because you're trying to expel what you have. And instead, you wouldn't blow into a handkerchief and put it over your face. Us funding laboratory experiments on coronaviruses, risky gain-of-function research in the lab.
Did you get to why he did it? why that was done?
The research?
Yeah, why they were so trusting of the Chinese?
Well, this is the interesting part, right? So people apply for a grant. He explained that there's a board that reviews the grant. He said they decide if it should go there. And then basically he said, all I do is sign the grant and sign it over. So we asked about oversight. You know, like, what about understanding the security and oversight of a foreign lab? He goes, well, I wouldn't even know how to do that.
Did we get any closer to the pressure that either Fauci brought or was put on Fauci to say that this was natural and not from man-made sources?
Well, he put the pressure by organizing a group. No, because it's interesting, as he organized the group that focused, these are their words, focused on disproving the lab leak theory. They were all saying amongst themselves, which we had discovered, well, this thing looks engineered. We certainly can't rule that out. The day he released proximal origins on the White House lawn and told the country that these scientists said it came from nature and tried to just drop, that very same day, there's a message from one of the authors saying we cannot rule out engineering, not the way this looks. And there's so much
You know the why?
there.
Why he was doing that?
We don't know the why, right?
All right.
And we have suspicions, though. We'll keep going.
Keep going.
All right.
Let me know when you find them, all right?
All right.
No, this is important work.
It's very
you guys
important work. 1.2 million people died.
I've presented at the FDA advisory meetings. I've advised companies for decades on this, so I know the regulatory science very well. When a product definitely results in death, and there are thousands of peer-reviewed papers on this, Governor, the COVID vaccines in some people, sadly, result in death. Some on the very first day they take the shot. That must be a black box warning on the product immediately. I just checked the package inserts for the currently available products, the ones that Senator Blumenthal wants to pursue. Sounds like Governor wants to still pursue these. Our FDA still wants them to be administered. They still don't have the word death in the package insert. As of today, they don't. And so Americans are not fairly informed.
Do you have any doubt in your mind that the COVID injection caused some deaths? I mean, what do you think of the, 38,607 right now listed on VAERS? What do you think the real number is? And do you have any science to back up your opinion?
The best data are autopsies. So in the largest autopsy series published to date, I know because I'm the senior author, of all the deaths we examined, and we re-reviewed them. We had an adjudication committee. We had ways of arbitration deciding on did the vaccine cause death. The answer is, of these cases that came in for autopsy after vaccination, 73.9% of individuals, it was determined that the vaccine was the cause of death. First author is Holscher and colleagues. He's sitting right behind me.
And again, by FDA's own laws, that should be included on that package insert, correct?
Immediately in 2021, Dr. Carol Tassetta, working with the Daily Cloud, wrote Peter's Marks in the summer of 2023 and said, where's the black box warning? Where is it? No word from Marks.
Dr. Vaughn, you want to weigh in on the informed consent?
Well, the other thing is, I think emergency use authorization, actually by definition, when you fill out the documents for the patient, if they read it, it actually says that they should make sure that they are under no compulsion to get this product. And that is what's so confusing, because even though the product was mandated in the summer, at the end of the summer of 2021, the product on the shelves was still the EUA product. And in that sense, for somebody to be mandated to something that they also have to sign to say that they weren't mandated to do it is kind of hard to do legally.
By the way, that's the subject of a couple oversight letters in terms of the whole full authorization type of thing. Dr. Thorpe, quickly.
Yes, on informed consent, there was completely the opposite in pregnant women. HHS appears to have captured the American College of Obstetricians and Gynecologists, and my research team, including Maggie Thorpe, JD, have proven that with the Freedom of Information Act.
For a few million dollars, correct?
Many $1 million. They captured ACOG. In December of 2020, everybody at ACOG and the other organizations, we're not going to push this vaccine in pregnant women. In the span of a pregnancy, 40 weeks, September 27th, 2021, you will push the vaccine. You will push it in pregnant women and follow all the HHS criteria. And if you don't, we will destroy you. Career will take your license away and we will decertify you. That went out to 60,000 OBGYN doctors. So
we probably should have expanded the title of this: corruption of science, federal health agencies. What would you call those? Professional organizations?
These are the three organizations that essentially govern obstetrical care, not just in the United States of America, but the whole world.
By the way, I wanted to ask you, to what extent are the medical journals funded by various conflicting organizations, pharmaceutical companies? I've heard Chinese interests. I mean, are you aware of that? You were talking about the article written by the editors of the New England Journal of Medicine.
Yes, I'm aware of the study by Wen and colleagues, David Daniel Wen, that was just published October 10th of 2024, documenting that 1.06 billion with a B dollars went to the reviewers of the medical journals, of probably the most influential medical journals: New England Journal of Medicine, Lancet, BMJ.
That's coming out of the pharmaceutical industry.
That's correct.
So, Dr. Walscott, as a vaccine injured, do you believe you received informed consent?
Absolutely not. Absolutely not. I mean, informed consent, and I, as a physician, I believe strongly in informed consent. Informed consent requires true and transparent data. And we can sit here and hear the mantra or the typical narrative of safe, effective, saved millions of lives, but in reality, that's not true.
And of course, the Biden administration are still unable to admit that Trump's presumption was in fact correct.
I want to speak to Dr. Fauci because the political attacks on someone like Dr. Fauci, who and public officials more broadly, but Dr. Fauci, who has spent his career saving lives.
Anthony Fauci. Fauci was pardoned, quote, for any offense against the United States which he may have committed or taken part in during the period from January 1st, 2014 through the date of the pardon. It's revealing that the primary public reason presented for the pardons was to avoid investigations. There are, of course, plenty of unseemly details about Fauci's career that the political establishment would not like to see resurface in either the court of law or the court of public opinion, such as the secretive and deadly drug experiments on hundreds of HIV-positive foster children.
What the fuck?
At New York City's Incarnation Children's Center between 1988 and 2002. And the experiment that locked the heads of beagle puppies into cages full of flesh-eating insects.
What the fuck?
If Fauci had come under the federal government's microscope, episodes like those could have done much to stain the name of the man Biden recently dubbed a true hero. His warnings did result in his department and other parts of Washington's public health bureaucracy getting billions of dollars in new funding.
And for a bit of light relief, American comedian Jon Stewart didn't back down from pointing out the obvious.
What do you mean by that? Do you mean like perhaps there's a chance that this was created in a lab, there's an investigation?
A chance?
Well, but
oh my
if
God.
there was evidence, I'd love to hear it. I just don't know.
Are you fucking retarded? The hell's the matter with you?
Novel respiratory coronavirus overtaking Wuhan, China. What do? Oh, you know who we could ask? The Wuhan Novel Respiratory Coronavirus Lab. The disease is the same name as the lab. That's just a little too weird, don't you think? And then they ask those scientists, they're like, how did this... So wait a minute, you work at the Wuhan Respiratory Coronavirus Lab. How did this happen? And they're like, a pangolin kissed a turtle. And you're like, no, the name of your lab. If you look at the name, let me see your business card. Show me your business card. Oh, I work at the coronavirus lab in Wuhan. Oh, because there's a coronavirus loose in Wuhan. How did that happen? Maybe a bat flew into the cloaca of a turkey and then it sneezed into my chili, and now we all have coronavirus. Like, come on.
Wait a second.
What about this? What about this? Listen to this.
Wait a second.
All right.
John.
Oh my God. There's been an outbreak of chocolatey goodness near Hershey, Pennsylvania. What do you think happened? Like, oh, I don't know. Maybe a steam shovel mated with a cocoa bean. Or it's the chocolate factory. Maybe that's it.
Who can take a chainsaw? Who can take a chainsaw? Got a girl in two. Got a girl in two. Fuck the bottom half, give the other half to you. The S&M man, cause he mixes it with love and makes the hurt feel good. The hurt feel good.